Hello and welcome. This is Dr. Michael Gaeta. Thanks for joining us today. Wanted to nail another of the popular vaccine myths and set the record straight and separate the propaganda from the facts. And the myth is, the propaganda says that vaccines saved humanity from the scourges of the epidemic infections of many years ago. And so that's, the common myth is that the mass vaccination program somehow saved humanity from, devastating epidemics of days gone by. So let's see if that's actually true, and see, we'll set the record straight on that. So the myth goes something like this, that vaccines eliminated many epidemics and saved millions of lives. The CDC claims, without evidence, that thanks to vaccines, some diseases are almost gone from the US. And let's see if that's actually, in fact, true. There are several independent research groups that have looked at this question and looked at not the propaganda, not the, the popular beliefs about this and what we hear from mainstream media and mainstream medicine, but actually let's look at the data, let's look at the evidence, let's look at the historical facts. And so a couple of good places for source material that independent research groups have evaluated and come to the same conclusion is the Vital Statistics of the United States and Historical Statistics of the United States, Colonial Times to 1970, Part 1. The healthsentinel.com team was one of those, but certainly not the only that looked at this. And what we're going to see in looking at some of these stats is a theme. And we're going to see this theme over and over again. The theme is that without exception, all of the vaccinated diseases or epidemics or infections that we had or pathogens that we have vaccines for were well into their decline before the vaccine was even available. That's just historical facts and data. So that the decline in incidence and decline in mortality, so how many people got sick, how many people died of that thing, was already well into its decline before the vaccine was even introduced. The vaccines, without exception, were the Johnny-come-latelys that came sort of at the end of the cycle, or at least mid-cycle when the decline was well underway, and then everybody gave credit to the vaccine, which had nothing to do with it. And then the second theme we're going to see is what the factors actually were that caused the decline in the incidence, for example, of measles or diphtheria or so forth, things that we vaccinate for. And finally, we're going to see that the conditions, the infectious diseases for which we never had a vaccine, like scarlet fever, like tuberculosis, very debilitating epidemics 100 years ago, there was never a vaccine for them, and those conditions went away in exactly the same time frame for exactly the same reasons as the vaccinated conditions like measles. So let's dive into the data a little bit here and just see what the facts say, again, not the propaganda, but the facts. What does the historical evidence tell us when we actually have the courage to look at and challenge and question the official story? So let's take a look here. The one I want to look at first is diphtheria. Diphtheria was, certainly a significant epidemic. A lot of people died from diphtheria back in the day. And the mortality rate, how many people died from diphtheria, was well into its decline after 1900. And for 20 years, diphtheria, less and less people died per capita from diphtheria for 20 years before the vaccine was even available. And the vaccine had nothing to do with the decline in mortality from diphtheria. So that's sort of great first example to look at. Pertussis, whooping cough. Death rate from pertussis was significant in the late 1800s, early 1900s, and went down continuously had, you know, ups and downs year to year. That's normal. But the overall trend, obviously, is that deaths from whooping cough, and again, is that a possible complication of these infections? Of course, you can get a complication. You can die from anything. You could, you know, cut your arm or scrape your arm. You could fall and scrape your arm and die of sepsis. So this whole like rare complications from measles or whatever justifying mass vaccination is absurd, because you can get complications from and death from anything. It depends on the immune system, not the presence of the vaccine. So anyway, whooping cough was well on its way out. And when whooping cough deaths were very, very small, we're talking, you know, 2 in 100,000, 1 in 100,000, then finally the vaccine showed up in 1948. And of course, you know, the medical establishment, without evidence, claims that the entire elimination of pertussis, whooping cough as a deadly epidemic, was entirely due to the vaccine, which is not the case at all. So this is another myth, another lie used to promote, you know, these mass vaccination campaigns. The book you want to get on this, for sure, is from one of my favorite physicians. She's a board-certified nephrologist, also an internist. Suzanne Humphreys is a physician, one of the few courageous physicians who has the guts to step outside the tiny box of, you know, vaccine propaganda, pro-vaccine extremism, and actually had the courage and the intelligence to look for herself at the things that she learned in medical school about vaccines, which is that they saved humanity and that they're necessary for survival. Is that true? And she had the courage to question that, look at the evidence herself, look at the science, look at the evidence, look at the data, look at the historical record, and wrote a book about it called Dissolving Illusions. You should all get this book. It's remarkable because it's a book certainly not against vaccines, but certainly definitely a book of medical history. And it's the forgotten history, as she says, of how vaccines had nothing to do with the elimination of any epidemics. I really want to underline that. Just going to pause here for a minute and just underline a key point here, is that no vaccine ever eliminated any epidemic at any time in human history. I'm going to say that again. No vaccine has ever eliminated any epidemic at any time in human history. To claim that they have is a baseless assertion. And that's going to be the words of someone who hasn't actually looked at the evidence. They're simply content to believe whatever they're told by the medical establishment, by mainstream media, about vaccines. And they just don't question. They don't ask questions, don't challenge assumptions. They just believe whatever they're told. But for the few folks who have the courage to look at the evidence, it's a very different picture that emerges. And so let's look at another one, which is a great example, classic example, not unique at all, but the example of the measles. Measles was a big deal 100 years ago. 15,000 people died of the measles when the measles epidemic peaked in 1915. About 15,000 people died in the U.S. from the measles in 1915. That's a serious epidemic. Measles declined over the decades from 15,000 people dying in 1915 to about 400 people dying of the measles in 1962, when the population had increased sevenfold. We had 7 times more people in the U.S. By 1962 than we did in 1915, and the death rate plummeted from 15,000 to 400, even though the population had increased sevenfold. So that means measles deaths were eliminated by about 99% of measles deaths were eliminated by 1962, which is the year before the vaccine was even available in the public. It wasn't even introduced until 1963. At this point, nobody died of the measles. I mean, effectively. I mean, it was very, very rare that anybody died of the measles before the vaccine even came out. By 1963, and the measles was in the 1940s and 1950s and early 1960s, until the vaccine was available, measles was what the chicken pox was for decades after in my generation. It was a 1-week rash, no big deal. It goes away. It's a normal, natural part of childhood. That's what the measles was in the 1940s and 50s and early 60s before the vaccine came out. And then to promote the vaccine, suddenly and since then, they've promoted the measles as this like deadly disease that's going to kill you, just to sell the vaccine. But measles was a standard rite of passage in childhood, a 1-week rash that provided lifelong immunity to the pathogen, to the virus, before the vaccine was even available. And so it's a classic example. And so the question comes, well, why did all the epidemics go away? How come people stopped dying of measles and mumps and rubella and tuberculosis and scarlet fever, all these other conditions? Why? Simple. Improvements in nutrition, sanitation, hygiene, living conditions, and working conditions. That's simple. That's why all the epidemics went away. It had nothing to do with vaccines. The death rate and also incidence of these diseases went away. But we're particularly concerned with not with how many people get the measles, but how many people die of the measles. And that's the concern, is not incidence, but mortality. The common cold, the flu, these are normal, self-limiting, non-dangerous, non-life-threatening diseases in almost every case. That's what the measles was before the vaccine came out. So we're not really too fussed about people getting sick. We are concerned about people dying of these infections. And so the death rate, the mortality rate is what really counts. And then measles vaccine came out in 1963. The death rate continued to decline as it had for the previous several decades. But the incidence, the number of people who got the measles, plummeted. So we had a suppression of this normal childhood disease. And so the number of cases went down a lot starting in 1963. But the death rate was unchanged. It just kept declining as it had been until it faded away. These days, almost nobody ever dies of the measles unless they are severely, nutritionally deficient and therefore immune compromised. So the standard propaganda will say, hey, look, we came out with the vaccine in 1963, and look, the death rate plummeted. Look at that. Wow, the measles vaccine saved us from death from measles. That's not true. If you back up the timeline to 1900, in the second chart, and this is from a physician, one of those rare physicians that challenges the mainstream assumptions, Dr. Leon Chaitow, questioned the propaganda, looked for himself, and found, hey, wait a minute. The death rates from all of these diseases, including measles, was almost zero before the vaccine was even available. And so that's just what it is. So if we look at all the timelines together, and here's a more detailed, here's a combination timeline that I'll show you now, is the, here it is. This is the combined timeline. All of these vaccinated diseases were at least well into their decline in terms of death rate before the vaccines were even available. And so they became, non-life-threatening, non-dangerous things, which they once were, because of improvements in all these other factors that had nothing to do with vaccines. So it's very, very important that we recognize this, that vaccines did not, never will save humanity. It's very, very important. In England, same thing. In UK, again, same exact pattern happened. Now, we do need to talk just for a moment about a couple of specialty conditions. Smallpox was one, and the evidence is super clear. If a person has the courage to look at the historical record, smallpox ravaged communities and counties and areas and communities the worst where there was vaccines, where a particular community accepted vaccines to smallpox. That's where they had the most smallpox and the most deaths from smallpox. And in areas that didn't vaccinate at all, but used quarantine, for example, and just separated the sick people from everybody else, and other non-invasive public health measures like, sanitation and hygiene, that's where they had the least smallpox and the least deaths from smallpox. Leicester, England, very famous case of a county in England that fully vaccinated everybody in this area of Leicester, and they had the worst, they were like the worst ravaged smallpox area in Europe, or one of them. And then the public health guy in Leicester, the physician, said, hey, wait a minute, let's just see if we stop vaccinating everybody and just use quarantine and sanitation, let's see if it gets better. And Leicester immediately went to the lowest incidence and lowest death from smallpox of any county in England. They became like the model county. So smallpox had nothing, vaccine had actually worsened and prolonged the smallpox epidemic. It didn't lessen it or eliminate it at all. Now, what about tuberculosis? Tuberculosis was a terrible epidemic back in the day, early, 1900, for example, turn of the century, very ravaging, terrible, deadly disease. There was never a tuberculosis vaccine, and the mortality rate, the death rate, went away, as did the incidence in this case, without there ever being a vaccine, in exactly the same way as all the vaccinated diseases. The vaccines had nothing to do with the elimination of tuberculosis because there was never a vaccine. And you'll notice the decline is exactly the same time frame for exactly the same reasons. Scarlet fever. Did your grandparents get their scarlet fever vaccine? No, they didn't, because there never was one. And the death rate from scarlet fever declined without vaccination. And the vaccinated diseases also declined without, regardless of the fact that we created a vaccine to those diseases. So it's the same reasoning why the epidemics went away, had nothing to do with vaccinations at all. So this is just to give you some more evidence. This was Dr. Gordon Stewart. And Dr. Stewart is a physician who was part of the National Health Service in epidemiology and preventative medicine. He was a fellow of the Infectious Disease Society of America, professor of public health, University of Glasgow, consultant physician. Anyway, this is a very seriously credentialed, conventional physician who was right in the middle of these epidemics in his career. And what did he say in 1977? Because he was there, this is what he talked about pertussis. There was a continuous decline in whooping cough or pertussis starting in 1937. The pertussis vaccination only began on a national scale in 1957, 20 years later. And the introduction of the mass vaccination to pertussis did not affect the rate of decline. And that is the fact. With this pattern well established for 20 years before 1957, when the national scale vaccine was introduced, there is no evidence that vaccination played a major role in the decline in incidence and mortality. So how many people got the whooping cough, how many people died of whooping cough in the trend of events. Yet more evidence that vaccines had nothing to do with the elimination of any epidemic. This is a quote from Dr. Humphrey's book, Another Courageous Physician Questioning the Propaganda. Sanitary infrastructure, understanding of hygiene, vastly improved nutrition, labor laws, advances in science, many other factors coalesced to create this radical shift that started in the mid-1800s and went into the early 1900s. And so this was why, if you look at the historical record, why all the infections of yesteryear happened, why we're not dealing with these epidemics anymore, has nothing to do, zero to do with vaccines. The flawed belief that vaccines and other medical advances were responsible for this amazing decline dictated how infectious diseases are treated today. An amazing quote from another physician who is acknowledging that the propaganda is simply not the case. And so, this is not, this is just how it is. And again, Having treated children for 25 years and been in practice for 28 years, I can tell you for sure, absolutely, that children, particularly when they're young in the first couple of years, they need to get sick. It's normal, natural, and healthy for children to get sick when they're little. It's normal. Back in the day, I had the chicken pox. I still have a scar over here. But before my time, it was the measles, normal, natural, immune-enhancing, lifelong, immunity-producing childhood disease. And so we have this deathly fear of kids getting sick, which is really unfounded. In Chinese medicine, we talk about fevers in childhood, in early childhood, first 2 or 3 years of life, help to detoxify maternal toxins that are passed on from breast milk. There's hundreds of toxins because of our toxic environment that get passed from the mother into the breast through the breast milk. Definitely breastfeed, breast is best, but understand that there's toxins that are transmitted to that baby in breast milk. And breastfeeding is the best protection, giving babies those immunoglobulins in the breast milk. So a child going through a cycle of fever or infection helps in many, many ways. And we know that the incidence of chronic disease is greater when children don't go through natural cycles of infection when they're little. So kids need to get sick. Rarely is it dangerous or life-threatening. It's actually therapeutic. It's like you go to the gym, you work out, you stress the muscles to make them stronger. You go through some, an infection or two when you're a kid. It's actually a stress that makes your immune system stronger. The immune system is like a muscle. It needs to work out sometimes and go through cycles of infection, which is therapeutic, it's detoxifying. And actually you come out on the other side, as long as you don't suppress that infection with antibiotics, which is a whole other story. If you approach this non-suppressive approach to pediatrics, then you end up with stronger, healthier, more resilient children. When I was born in '69, I had all my vaccines, 6 vaccines in those days. Now it's 72. We keep piling on the vaccines willy-nilly without any evidence or urgency to do so. And so this is just a very, very important thing to keep in mind. Just a little more evidence from you for you on this subject. It's very, very important that we get this one right. Let's hear the words of Dr. Glenn Dettman, who's not a physician, he's a pathologist. And he won the Australian Medal of Merit for outstanding scientific research in Australia. First-rate scientist, national award. It is pathetic and ludicrous, Dr. Dettman says, to say that we ever vanquished smallpox with vaccines when only 10% of the population was ever vaccinated. Incredible. And we can look at another physician, Dr. Archie Campbell, up to 90%. It's actually greater than that. It's closer to 98% of the total decline in death rate of children from 1860 to 1965 because of whooping cough, scarlet fever, diphtheria, measles occurred before the introduction of immunizations and antibiotics. So another courageous physician telling the truth. That's not the mainstream propaganda. And so we can just acknowledge this. And then we can also listen to an immunologist, a PhD immunologist, who went into her PhD program in immunology at the Rockefeller Institute, very prestigious medical institution, and started her PhD program really into vaccines, as most immunologists are, and had the courage to look for herself. Well, is that true? Can we verify that? What does the evidence say? What does the science say? What does the historical record say beyond the propaganda? And what she looked at as an immunologist, she saw no reason to question or scrutinize the proclaimed virtues of vaccination. And she did the homework. She put the time in. She looked at the evidence, looked at the science. And what did she find? That the justification of vaccination is based on incomplete and often misapplied knowledge of the immune system. Furthermore, the justification persists by disregarding much of the evidence, including the epidemiological evidence, the population studies that prove the epidemics were well into their decline or gone, in terms of least of mortality, before the vaccines were even available. And so this is very, very significant that we just get beyond the propaganda and look at the evidence, look at the science, look at the data. So the next time somebody tells you, or you read in the newspaper or your Time magazine or whatever it is, remember that mainstream media, the number one advertiser in mainstream media is a pharmaceutical industry. So mainstream media is very loath to tell the truth about vaccines because they will annoy their greatest source of advertising revenue, which adds up to about $6 billion a year in advertising revenue just in the US of pharmaceutical companies advertising directly to consumers through mainstream media outlets. And so they don't want to bite the hand that feeds them. So you're never going to find unbiased, objective truth about vaccines anywhere in the mainstream media, or rarely, for that reason, because their advertising lifeblood is on the line. And so that's why there's such extreme bias towards vaccines in the mainstream media. And so next time you hear the propaganda vaccine saved humanity, now you know better, and spread the word. So if you want to hear more or learn more about this, definitely get the book Dissolving Illusions from Dr. Suzanne Humphries. It's a masterpiece of medical history, of what really happened back in the day. And it also details how the anti-vaccine or pro-choice movement started not with Andrew Wakefield in 1998. That's another lie. And he didn't speak against vaccines anyway in 1998. That's a whole other story. But the anti-vaccine movement started in 1900 with the mandatory smallpox vaccine causing horrible rashes and eczema and death, that the people revolted. They're like, you can't force us to vaccinate against smallpox. It's killing us. Look at it. It's ruining our children. It's killing our children. We have to stop mandatory vaccination against smallpox because the vaccine is much worse than the disease. And they did. And then because the people stood up, they stood up for their right to choose, for informed consent, healthcare freedom of choice. That's what happened. They eliminated mandatory vaccination to smallpox because it was doing far more harm than good. So hopefully that will continue, and I believe it will. I'm confident that enough people will wake up and take a stand, not against vaccines, but for choice, to have the freedom to choose. And then if you somehow believe the vaccines are great and safe and effective and necessary despite lack of evidence, you should have a right to choose. But no one should be force vaccinated or mandated vaccinations without exemption. So get Suzanne Humphries' book, Dissolving Illusions, if you have the courage to look at the facts. If you want to take a stand for vaccine choice, go to nvicadvocacy.org. nvicadvocacy.org is a free private service where it tells you what bills are in your state that are pro-choice, expanding and preserving vaccine choice, and what bills are seeking to impair vaccine choice and parental rights. If you'd like to learn more about vaccines, go to my website, michaelgaeta.com, and click on the blog, and I've got lots of free articles there and a link to my Quora page where you can debunk a lot of the vaccine propaganda. You can learn more about that there. Thanks for listening. And again, have courage and witness and acknowledge and take a stand for the truth that you know. Take care and be well. Bye-bye.